I'm Dr. Bryce Anderson. I run Anderson Family Chiropractic in Mankato, Minnesota. I've been a chiropractor for 20 years. What inspired me to become a chiropractor is I have always done things with my hands, building things, and I always wanted to be a doctor. And I had a counselor say, "Have you ever heard of chiropractic before?" And I said, "No." And he said, "There are doctors that work with their hands." And so that got me into looking into chiropractic, and it also fit my philosophy of I don't have a headache because I'm lacking aspirin or I'm lacking a tablet of ibuprofen. There's something going on in there, and that's what had kind of led me down the road of chiropractic. The education that I went through was I went to University of Minnesota Morris for my undergraduate, and then I went down to Logan College of Chiropractic in St. Louis. And once we graduate from there, we have to take 4 national board exams, and then we have to apply for the state that we are going to practice in, and then we have to take a test for that, and then we are able to practice in that state. Type of patients that I help. The quick and easy answer to this is to everybody. I had a professor in college that has a humorous way of announcing this one. He has 2 questions for you. Are you alive? And do you have a spine? Then you can have chiropractic care. Most common problem that we take care of here is kind of a toss between low back injuries and headaches. I recommend that you can get adjusted at any point in time in your life. And in fact, the very best adjustment that you can have is that very first one right out of the womb. Okay? Infants go through a lot of trauma when they go through the birthing process, and that can be some of the most powerful adjustments that an infant can receive, is that very first adjustment right after birth. What do I say to the naysayers? Well, I saw a meme that said it quite succinctly. Chiropractic is like gravity. You don't have to believe in it for it to work. So it's not a philosophy, it's not a religion. It works. We are moving things, physically putting things back to where they're supposed to be. And so there's no mind over matter that has to happen for it to work. Most challenging part of my job is twofold. One is the business side. We're running a small business, trying to be a doctor and running a small business at the same time, trying to keep your doors open, dealing with insurance companies and payments and the like. And then you have the other side is you have certain problems that come through the door that are tough. And we have to use all the skills and all of the things that we've learned over the years in order to fix that problem case that comes in. What I find most rewarding about my job is when a patient walks in or crawls in or drags their foot behind them, and I do what I need to do to fix that problem, and they walk out straighter or they walk out feeling better. There's nothing more rewarding than that.